Hey everyone, I'm so excited to be a part of the Toronto Waterfront Women's Training Program. My name is Dr. Sydney Lake and I'm a licensed naturopathic physician based in Victoria, BC. I'm no professional athlete, but I have been running for the past 15 years and it truly is amazing what our female bodies can do. I'm really excited to be speaking with you about iron and its impact on female athletes, because about 1 in every 3 women of reproductive age has iron deficiency. This can impact not just physical performance, but so many other areas of an individual's well-being. I also just wanted to note that during this talk, I'm not only talking about biological females, but any folks who menstruate will be included in this subsection as well. So let's start off by talking about the red blood cell and iron. Essentially, to understand how iron can impact you as an athlete, we need to go over the basics of red blood cell anatomy. Essentially, the red blood cell is a flexible little disc that's made of 90% hemoglobin. Hemoglobin is what binds to oxygen in our lungs and then carries it through our capillaries and takes it to our other tissues. If we take a closer look at hemoglobin, this is where iron really comes into play. Hemoglobin is a structure that's made of 4 protein subunits, where the center of each of these little subunits is an iron atom and a heme group. So each hemoglobin has 4 hemes and 4 iron, meaning they can carry 4 molecules of oxygen per hemoglobin, and they're kind of shaped like a little square. Red blood cells aren't just made of 1 molecule of hemoglobin each. There are about 300 million hemoglobin molecules inside of a single red blood cell. So when you do the math, if each hemoglobin has 4 atoms of iron, then there are almost 300 million hemoglobins in each red blood cell. That is a lot of iron that we need to transport oxygen to different tissues. So what does having low iron actually look like? The most common symptoms you would see are fatigue, low energy, reduced stamina, reduced exercise tolerance. So essentially you're getting tired more easily during normal exercise that you haven't really experienced before. You can also have shortness of breath from walking or going up the stairs, dizziness, lightheadedness, headaches. Brain fog is also commonly seen with low iron. And then you can have heart palpitations or the feeling of pounding in your chest. There are also changes in mood, so anxiety, irritability, low mood. You can see things like hair loss or brittle nails, and then people with low iron can also have restless leg syndrome. So let's talk about iron deficiency anemia. Anemia is the condition of having low red blood cells or hemoglobin. There are a bunch of different types of anemias, but for the purposes of this video, we're just going to speak about iron deficiency anemia. So iron deficiency anemia, or IDA for short, is diagnosed when an individual has low hemoglobin and low iron levels. Ferritin is the stored iron that we have in the body, and that's the lab value that we use to test our iron levels. You can also have just an iron deficiency and not have anemia. So this would show a normal hemoglobin, but low ferritin on labs. So IDA, or an iron deficiency, can only be diagnosed through blood tests. So where do we get iron from and what impacts absorption? Essentially, our bodies can't make iron, so we have to get it from our diet or from supplements. If we talk about dietary iron, there's 2 types of iron. There's a heme iron and a non-heme iron. The heme iron comes from animal sources and the non-heme iron comes from plant sources. The thing is that heme iron is more bioavailable, so that means if we ate the same amount of heme and this to non-heme, we would absorb way more of the heme iron compared to the non-heme. So another issue with getting iron from our diet is that there's so many variables that impact our absorption. We briefly talked about bioavailability, but iron absorption is also impacted by our digestion and other foods that we eat alongside our iron-containing foods. People who have absorption issues like celiac disease, IBD, chronic gastritis, or people who've had gastric bypasses will have reduced absorption of iron. And it's also noted that autoimmune diseases like celiac disease are more prevalent in women compared to men. Additionally, if you consume iron with coffee, tea, calcium, legumes, or whole grains, the iron that you think is being absorbed is actually going nowhere. Iron can bind to calcium, tannins, which are in coffee and tea, and phytates, which are in legumes and whole grains. And this essentially blocks iron from being absorbed. There are also many common medications that interfere with iron absorption. Now, why is this topic so important in women and people who are menstruating? Like I mentioned before, in about 1 in every 3 women of reproductive age has iron deficiency. Why? Because we bleed every month and lose lots of iron. So women with a regular cycle lose about 30 milliliters of blood per cycle, and this equates to a median measured loss of about 0.87 milligrams of iron per cycle. Now imagine a heavy bleeder who loses 80 or more milliliters of blood per cycle. They have a median loss of about 5.2 milligrams of iron per cycle, with some losing over 8 milligrams of iron per cycle. If a woman's losing iron every month without ever repleting it, it's very likely they can become iron deficient. The medical system has also been using a ferritin level of under 15 to diagnose iron deficiency. The problem with this is that women can have symptoms of iron deficiency even if their iron is anywhere below 100. So there's a big gap between having a ferritin of 15 to 100, which leads a lot of women being left out of being treated for iron deficiency, because essentially they won't treat you if your iron is not below 15. So if we look specifically on how this impacts female athletes, a less ability to bind oxygen means less oxygen is getting to your muscles and poorer performance overall. Studies have found that high-level female athletes who have iron deficiency can have up to a 4% reduction in endurance performance. And if you're elite, that 4% can make a big difference. Studies have also found a reduction in maximal aerobic capacity that's proportionate with the severity of iron deficiency. Another thing we need to keep in mind is that female athletes, especially female endurance athletes, are more susceptible to underfueling. This is partially due to high energy expenditure from training, but also from societal pressures around having a certain body image. So, if we put everything together, it can be hard to get your daily amount of iron through the diet because of many reasons. Factor that in with being a menstruating woman who loses significant amounts of iron every month, and being an athlete who could be underfueling. This can all add up to really impacting the amount of ferritin that you have in your body. So what can we do about this? The first step would be seeing your family doctor or primary care provider to get your iron levels tested if you are a menstruating individual with symptoms of iron deficiency. It can take a minimum of 3 months to increase your ferritin, so you can't just take an iron supplement the day before your race and think that you're all good. Just a disclaimer, this is not medical advice. You do need to see your primary care provider and get all the right labs done before taking any type of iron or treating yourself. But if you're currently taking iron, make sure you're taking your oral supplements at least 30 minutes away from all food and drink besides water. And it's also been found that supplementing with your oral iron every other day can help with absorption. Supplementing with oral iron doesn't work for everyone because there are a lot of GI side effects and people who have absorption issues and are taking certain medications, of course. Some women do qualify for getting an iron infusion from their medical doctor or nurse practitioner, and in provinces like British Columbia, licensed naturopathic doctors can do iron infusions as well. All right, so this was just a brief overview about how iron impacts the female athlete. I really hope you all learned something today, and thanks for sticking around. Thanks again for the Toronto Waterfront Women's Marathon for having me out, and happy running, everyone.